And we are coming to our last presentation for the evening. And we always keep the most interesting for the last. Last but not the least, as they say. The title of the presentation is An Islamic Perspective on Medical Ethics.
I will give you my card.
Islamic medical ethics is becoming a very interesting topic. And to just give you an idea why Islamic medical ethics is so important, is that even other religions, like Judaism and Christianity, are truly becoming interested in what Islam has to say about medical ethics. And as you know that Islam is practiced by more than 1 billion people in the world, and their opinions do count. For this very reason, the Islamic Medical Association set up an Islamic Medical Ethics Committee in United States almost about 6 and 7 years ago. And I was honored to be serving on it as a member of the Board of Islamic Medical Ethics. And we discussed many, many issues. It's a very detailed and very complicated subject to discuss Islamic medical ethics. And just to tell you for short, on 30th of March in Tampa, Florida, we are having an Islamic medical meeting discussing Islamic medical ethics. And we are, expecting about at least 100 physicians to attend. So it is a very hot topic, and I'm glad that Dr. Amer Hamid is taken to speak to us about that. Dr. Amer Hamid is a man after my own heart. Why do I say that? Because as a cardiac surgeon, you're always dependent on a cardiologist. That's one reason. The other reason is that my son is an intervention cardiologist. He practices, and he always tells me, Dad, cardiac surgery is getting out. In a few years, we will drive you out of business. And my answer to that is, I say, be my guest, because I want to get out of business. So cardiologists are very good, and he is a locum cardiologist consultant at the Leighton Hospital in Crewe. He, of course, does his MSc in cardiology from Pisa in Italy, a very old institution. He is also licensed in nuclear cardiology, and he is certified as a cardiac CT reader. He is a member of the working group of acute cardiac care of ESC. I don't know what that stands for. Well, European Association of Cardiovascular
European Society
Association.
of
Prevention. Yeah. Rehabilitation. He is a regional fellow of the Royal Society of Medicine and a member of the International Society of History of Islamic Medicine. He is ex-chairman of the Scarborough Muslim Association. That's interesting, Dr. Ahmed, because the first job that I was offered in the United Kingdom was in Scarborough. So I remember Scarborough very well because that's where I went for my interview. He is an voluntary chaplain of Muslims at the Hull University. That's where actually I did my first job, at the Hull Infirmary, Royal Infirmary. I did my first surgical residency over there. And he is an ex-BBEMI director of BMCC, Barnsley Muslim Community Center. So with that excellent credentials, I would like Dr. Ahmed to come and tell us about Islamic medical ethics. Thank you.
Thank you, Dr. Nagamia. Thank you all. I really enjoy today. I want to thank all the people who had done this program and make it happen from everybody. It's an excellent program. I know that most of them are students, and it's difficult and hard time to have the time and enthusiasm to do all this hard work. So I really want to congratulate them all. My job is difficult because I'm the last one, but being a cardiologist, I'll have to squeeze a bit fast. I come from Crew now, and Crew still one of the few sites in the country that still produce cars, excellent ones, which is Bentley. If you don't know, it's produced in, actually I was searching yesterday about it, and Bentley actually founded before any car industry in this country. And it is not even founded before the current owner of them. Does anybody know who owns Bentley now? No, actually Volkswagen owns it. So, and you're right, Qatar owns 17% of the share. So I hope we'll start to contribute in research more than money as a Muslims. But that's why my research yesterday about Bentley. And it was founded in 1919, so it's a long time ago. I don't think I'm going to talk about these because it's already said. But I think I find my work in the voluntary side more rewarding than my cardiology side. I know some of the students might find it hard to believe for a cardiologist, which the hallmark, yesterday I was giving a lecture about ECG, and one of the junior students tell me, we can't talk with the cardiologist because they're arrogant. I said, yes, I totally agree. Surgeon, neurosurgeon, and cardiologists are the most arrogant of the doctors. But I think we have to, and I can admit, in my work on the voluntary side, I try to gradually humble my side and lose of this arrogance, which is obviously one of the big sins in Islam, takabbur. ESC is European Society of Cardiology, the old name for the acute cardiac care, just for Dr. Nagamia. The old name, the new name is Acute Cardiac Care Association. This is what my one of the old pictures, and I think you can see some of the famous there. Dr. Nagamia was there, isn't it? It's quite an old one. I come from Mesopotamia, was mentioned earlier, so I come from there. I come from that place. Just remember that place and remember that place because we're going to talk about it. But this is as we already mentioned, this used to be what the cradle of civilization before. And if you open any history books, it's all started there. The farming and all the industry, also all the civilization of human beings. And you have also to remember that place because we're going to mention something about it now, especially with the Syrian revolution. But the slide about Hammurabi, actually Hammurabi was obviously the civilization was there. He not only put ethics and a law for the human doctors, he actually put a law for the vet doctors, to the extent that if you are a vet and you kill an animal, there is a punishment for you. You see how depth they are, even for a vet surgeon in that 1,000 years before. So I don't have much time, so I have to just jump. And that place for your religious knowledge, Nabi Yunus, Prophet Jonah, for people who are non-Muslim, I think there's only one or two, maybe not. But anyway, Prophet Jonah, Jonah and the whale in the Christian culture, that's Prophet Yunus, chapter of the Quran. That's where I come from. And to the credit of Saddam, may Allah bless him, people might be difficult with him, but he's a dead man. We have to always bless a dead man, whatever he has done. He was the one who renovated that, Saddam authority. Actually, the chief architect of Saddam was a Christian engineer, to be fair to Saddam. So that's Prophet Yunus now, and he made access to the Christian to visit that, because the Christian, as you know, it's a Christian culture. So from the time it's renovated now, the Christian can come and to go to the area, not obviously the praying area, but the other area. So that's one of the, that's my hint about that. Now, talking about Prophet Yunus, and this is part of us, that tell us what's the basic of ethics in Islam, is that we're talking about errors in medicine, and now there's a lot about medical errors, and when you do something wrong, as a physician, as a doctor, as a scientist, as a knowledgeable person from whichever level, do repent. And that's the message of Sayyidina Yunus teaches in the Quran. If you've done something wrong and you realize it, it's never too late to repent and go back. And this is the story of Sayyidina Yunus, who have a whole chapter of the Quran about it. And it's telling us, as a whole village, as a whole community, if you are doing something wrong, go back to correct yourself. and start back and start from the beginning. Now, there's a lot of Mosul in Christian religion, Christian heritage there. In fact, Mosul was the basis of the old Jewish people in Iraq before they left to Palestine in 1948. And I actually did my baccalaureate exam in a Jewish school, deserted Jewish school, and the government have to use it as a public place for doing exam. And these are one of the famous two churches. One of them I used to go for my next door Christian Orthodox to do their wedding there. I used to go there with them in their occasions. And this is one of the famous Nader Shah battlefield, which is the castle of Mosul. Is also something somebody talked about Salah ad-Din before, and we have to remember the one who raised Salah ad-Din, which is Nur-ad-Din Zinki, and that's coming back to Syria, because Nur-ad-Din Zinki was ruling Syria and Damascus with Salah ad-Din. That's all back to history, and his mosque in Mosul, Nur-ad-Din Zinki, Jami' al-Nuri in Mosul, which contained the only leaning minaret in the world, which is comparable to Pisa Tower. And actually, again, the time of Ba'ath Party, Saddam, whatever you call it, they brought special Italian company to do it, the same way they have done Pisa Tower, because it's very sophisticated, and they have done it. And this is Minarat al-Hadban, which the Mosul is not known for it. Al-Hadban means the leaning. That's why the whole Mosul called the leaning. Coming back to the main subject, why human beings is important for us as a doctors, as a human beings, as a Muslims, is our principle, Islamic principle. I want to conclude, although it's not a lot of time left for me, but this is the base of it. The Surah Al-Isra, وَلَقَدْ كَرَّمْنَا بَنِي آدَمَ, that human beings is dignified. And that's why you have, when you treat human beings, you have to be careful. This is the creation of Allah. So from an Islamic perspective, you should not harm him or her. So that's the basis of that. لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ. Allah created human beings in best of shapes and uniform. So be careful when you deal with him, with her. Be expert before. And that's why in medicine, in Islamic medicine perspective, the two main principles that Islams tell us is the sanity of a human life, which was mentioned, the surah, whatever saves a human life, saves the whole of mankind. And this is the basis of organ donation now, in which we have, as a Muslim, to contribute actively to it. As you know, some of the statistics recently was not good for the Muslims. About 8% of the Muslims receive kidney transplant, about 2% give it. And the excuse that we are not allowed. Why are you taking the 8%? So sometimes don't try to bend your religion for your own sake, because we are prevented from doing so by the verses of the Quran. يا أيها الذين آمنوا إن كثيرا من الأحبار والرهبان لا يأكلون أموال الناس بالباطل. Don't twist your religion for your own sake or for your sake of dunya. And the prophetic medicine, which is summarized by this core hadith, that for every disease, Allah give us a cure for it. The message is you have to seek it. And as we're saying, and many of the wonderful speakers, which I'm honored to be one of this group of honorable people before me, is that we have to search hard. And the young blood I can see in this good place to learn, King's College, is that you are going to be the new blood for searching furthermore for that. So we have to search hard to find this and not depend only on money. Because if it is only money and capitalism, then that's what's going to happen in the world. This is Fallujah, and this is starvation all over Africa, and this is famous one in 1994 in the famine of Sudan, in which even the animal is waiting for the human beings to die before the vulture will come and jump and eat it. So, and at that time, America was putting wheat in the sea, throwing it, so that the number of the price of it get high, and people are dying. So we have to remember that the Western world is blind, looking only for money and business. And we as a Muslim should tell everybody that we need to wake up. One soul is better than the whole. And that's why the basis, sorry for Dr. Nagamia coming from America, he was giving the example for us, that it is not fair that 30 or 40 million Americans will be kicked out of the hospital and America send stuff for the mass. Is that humane? No, Islam doesn't accept that. So we have to be, as a Muslim, we have always to remember our rules. And the basic of medical ethics is the base of Sharia. Sharia, the main base of our Sharia is 5 maqasid. Maqasid al-Shari'ati khams. These are the main thing. Preservation of religion, life, family, mind, and then the last one is money and ownership. So the first one is deen. And why is deen first? That's why people who got shahada in Islam, that's the perspective. So the second one, you sacrifice for your life because it is second to Sharia. Why? Because Sharia is justice. And we have to be just to other human beings. So if you have lost your property, if somebody take your home, like what happened in Palestine by Zionism, then it is worth to sacrifice our life to get justice, not because we are aggressor. No, we are defending our religion by that. Okay. Concluding. Oh, sorry, I haven't started yet. Now this is some of the rules of prohibition. This is basic of fiqh, necessity override prohibition. So certain items which is normally prohibited, like the usual example, if you are in the desert and you are going to die and there's only alcohol, then you're allowed to do that. But that's only if you are going to do so. And then accept the lesser of the 2 evils if we cannot avoid them both. Public interest override individual interest. I'm not sure whether Dr. Kafil Ghazal remember, last time we did a lecture in Leeds ethics, and there was one Leeds University PhD lady. She was saying, how come people in Mecca demolishing the homes of people around Al-Masjid al-Haram? This is not fair. I said, this is Islamic law. Public interest override. This is Islamically accepted, if you are going to. So this is our principle of Islamic law. And then harm have to be removed at every cost if possible, as long as it will not create more harm. So these are the 5 things that we said, and including the lineage and chastity and honor, in which a lot of Western culture doesn't much pay attention nowadays to these. And that's why when we're talking to non-Muslim about that, everything is personal. We say everything is allowed for us to drinks except one, which is alcohol. All the other drinks is allowed. All the other food allowed, except khinzir, except pig. That's not a lot. Allah gave us hundreds of, only judge us for this. Action is by intention. This is the basic of Hadith of Bukhari, which ulama say it's 1/5 of the fiqh. And that is one of the principles of intention in later on. Necessity should allow the prohibited and haram is to be removed. I'm sorry, I have to run a lot. These are the principles of Islamic medicine, principle of intention. That's what we said. That's Hadith al-Bukhari al-Mashhur. من كانت هجرته لامرأة ينكحها أو لدنيا يصيبها فهجرته لما هاجر عليه. Principle of certainty, in which we in medicine practice on that. If we know that this is a certainty, this is going to happen good or to produce good, then we'll do it. Now, if it produces harm, that is an exception. So we'll accept that in Islam. Principle of injury, that any injury should be prevented or mitigated as much as possible. Principle of hardship, and that we said that necessity legalized the prohibited. So in Islam, the usual example, story of Urwa, when he has a gangrene of his foot and they ask him to amputate it, to take alcohol so that they can amputate, because at that time they have no anesthesia. He said, no, I'll not do that, even for necessity. And he asked them to make salah, and he done it, cut his arm while he was doing salah. Principle of custom, al-urf, this is part of our religion. If something practiced generally have been there and accepted and predominant, then accept it as long as there's no anything about it, against it from Islam. Adab al-Tabib, this is the core thing what I'm going to talk, but I hope Ishaq Ali al-Rahawi, he's from Raha, that place I told you it was there, which is in Turkey, modern Turkey. He's the one who wrote this book with 20 chapters, in which if you are going to read, as if you are reading the General Medical Council chapter or book. You just look at them. Care of the physician body, from your physique, from your body. Start with your faith first, your ethics first. Why you want to be good to other people. Then what you're going to avoid. Direction to the physician, to the patient. Manners, care of the remedies, what you're going to give them. All these things. The second 10, even about harmful habits. Quacks, be careful about people who are quacks, and the care of yourself as a soul also. Ishaq al-Rahawi from Raha. This is the surahs of the Quran. which is also the same name with Sayyidina Muhammad for some. Now, this is part of another example shining Al-Tabari Firdaus al-Hikmah, the Paradise of Wisdom. This is one of the things that you read and you say, am I reading the new regulation of the GMC, or this is what have been done? This is all there. So you have to be clean, the clothes dignified. You should not avoid predicting whether that happen. You should, and that's why you're talking to patients. You have to give them all possibilities. You can't predict all the what's happened. And the rest of them, I'm afraid I don't have much time for it. But this is one of our modern medicine. You should not honor yourself by shaming other doctors. This is the principle of what we do nowadays. This is all for Firdaus al-Hikmah. You should speak well of other colleagues. Now, I am going just to go, sorry, I have to go to that one. This is the basic of practicing medicine. من تطبب ولم يعلم منه الطب فهو ضامن. It's in Arabic, but I'll try to explain it as Ibn al-Qayyim did. Ibn al-Qayyim did say that if you are a well-educated and knowledgeable person, then even if you made a mistake, unlike the MDU and MPS nowadays, you should not give a compensation. That's Islamic law. But if you are not, and it's ignorance, then you have to do that. That's the translation of the hadith. Man tatabbaba wa lam yu'lam. If you are practicing medicine and you're not good in it, you haven't been good, then if you're going to do a mistake, you will be punished by rewarding people. If you kill him or her, then you're going to give blood money for that. And obviously, he's come from Syria, Ibn al-Qayyim, and Syria. What was wonderful of my experience last couple of months ago, to drive an ambulance from Manchester, driving it down to Syrian-Turkish border, to deliver it with another 10, 11 ambulances to people in Syria. I ask every young people here, most young blood, to go and help. It's a massive thing that we need to do. And it's a wonderful experience in your CV. It's a good thing for you to do in a good cause. Now, this is the oath of the Islamic Amana, and this I'll not go further. This is in America, as America always, American Muslim doctors leading us. This is the Kuwait Islamic Organization for Medical Sciences oath done in 1981. This is some of the duties of the physician to our patient, and this is how we translate our ethics into modern day ethical issues. And I'm just commenting on the red one because some research raised by Dr. Sheikh in Edinburgh that even the modern Western world doctors are trying to not give much attention to Asian Muslim people because of many things. That's what the research shows, that they're not paying attention to them. Neither they do be compassionate regarding their cultural and ethnic tradition. And as you can see, that we are top of the list that is not good with. So you should not do that with any faith, regardless of what you believe. I'm going to scroll that. Anybody knows where is that? Al-Malwiya. This is the Mu'tasim Khalifa Abbasi who built the Malwiya. This is built many, many years ago. And the blessing of the, sorry, Doctor, the American, they came and explode that. So it's not there anymore, the top of it. So they thought there is somebody there, so they hit it with something, and that was exploded. So this is old picture. And we should not be ashamed of our heritage here, because Muslim was here in Europe a long time ago. Long time ago. And there is a proof for that. This is the proof. This is the Muslim declaration of faith on the gold minted coin by King Offa of England. And this is which should be our future. This is the minted dinar. For the ladies, if you are not married yet, ask your fiancé to bring you the dowry in Islamic gold. This is, you can buy it and sell it over the net now. And again, unfortunately, then the one who is leading that is the Malaysian brother, Jazahum Allah khair. They started that. It's the silver dirham and the dinar, gold dinar of all days Sayyidina Umar minted it. Our duty is to do a lot of these things, but I'm going to pass them because there's not much time. Confidentiality, these all need more lectures and more talk about it, how we're going to do that from Islamic perspective. And some of the other issues is, that's again some of the blessing of the American forces on us in Iraq. That's the Shiite mosque, one of the wonderful Shiite mosques in Iraq, Hadi Mosque. A new issue, organ donation. This is the whole challenges for us, young generation and all Muslims, to tackle. Organ donation now coming, it's coming to become low. How we prepare ourselves for that? What's our issues? We settled the issues about it, scientific research, and consent, how much we can say about it. And I have to conclude. Jazakumullah khair. Thank you.